mamas and mamas to be. This is the podcast that is going to take you into the Hen House. We are talking all things intuitive and mindful living and mothering, as well as preventing birth trauma and healing from birth trauma. We are bringing you real talk, real connection, real community, and hopefully some real inspiration as well.
We are your hosts, Andrea
and Chantal.
And if you're ready, it's time to jump into the Hen House.
Hello, everyone. Welcome back. So glad you're here. I'm super excited. We have a really wonderful guest today. This is Dr. Brianna Ozburn, and she is a physiotherapist and a pelvic health specialist, or pelvic floor therapist, for those of you who know it like that. And she is here in the Chattanooga area, and I would say the name of the town, but I don't know how to pronounce it. But yeah, so she's with the Pelvic Method, which is a really wonderful local business. And Brianna, I'm so glad you're here. So thank you for coming on.
Hi, Andrea. Thanks so much for having me.
Yeah. So first, because you are a fellow bookworm, I have to ask you what you're reading right now.
Well, I'm actually reading kind of the book that's taken everyone by storm, which is a funny pun because it's called Onyx Storm by Rebecca Yarros, which is the third book in the Fourth Wing series. So it's like a romance fantasy book right now. But I'm also reading a couple of audiobooks as well. I kind of tend to keep a constant stream of books going. I love it so much.
I know. I saw on Instagram, I was like, wow, she's fast. Like in 1 month, I swear there was like 10 books in 1 month.
Yes, I read 10 in January. But audiobooks and digital books help me do that a lot. I think I read one physical book in that entire month.
Okay.
A lot of audio on 1.5, 1.75 speed.
Because I'm going, you are impressive.
That's the trick.
That's awesome. So let's just jump right in. Tell us, what is pelvic floor therapy?
Okay, so pelvic floor therapy is pretty different than regular physical therapy. So instead of specializing, in like the ankles or the back or the hips or the neck, any like total body parts, we specialize in the abdomen and the pelvis. So we are able to assess and look at all things related to those areas. So any complaints related to the bowels, bladder, sexual function, or pain in those areas, we're able to treat. So also related to pregnancy and postpartum, any kind of post-operative surgeries as far as like abdominoplasties or hysterectomies, any kind of ovarian surgeries, we're able to kind of help post-operatively or also pre-operatively and help people that have symptoms of incontinence, like leakage with their bladders, or constipation, or prolapse issues. So that's kind of what we specialize in treating. And so it's pretty different than standard PT. But it's kind of usually always one-on-one, in a private setting. So it's a little bit different in that regard. But I've been doing it now for 6 years, and it's my greatest passion. I love it.
That's wonderful. Yeah, so I'll disclose already that way because it'll come up probably later. But I've done pelvic floor therapy with you. And I started, my doula had recommended, because I was getting the diastasis. Mm-hmm. And she was like, you need to see a pelvic floor therapist. And then as we got into it, it's like, wow, you can really help so much also for labor and delivery preparation and for kind of keeping everything relaxed during pregnancy. And again, like you had said, kind of helping with some of the urinary incontinence issues and stuff that come up during pregnancy. And so that was kind of how I started. And then you were definitely like absolutely integral in my postpartum healing, which was significant. And so I'm super grateful. So it's definitely like, it's so worthwhile. And I know you work with men and women as well. So I think some people also assume it's just for women or just for pregnancy or postpartum, but that's not necessarily the case.
Right. We see a lot of men in our practice. Actually, I see, almost a third of my caseload, maybe more currently is actually men as well. And we treat a lot of conditions for them that's a little bit different than for women. And some things are the same. We treat their bowel complaints, bladder complaints, sexual complaints, but they can also have a lot of like chronic testicular pain or penile pain, any kind of pudendal neuralgia or like tailbone pain for those men. My cyclists, people that are avid bike riders or Ironmen that have a lot of like hernia injuries and all kinds of those kinds of things. We can specialize in helping them as well.
Okay, yeah. I thought I'd put that out there, even though probably most people listening are women and are moms. But you know what? They may have husbands or partners who need support, and so I think it's good to know.
And that always happens. People can
So,
like their husbands, like they're like, oh, you can treat this. I mean, even like post vasectomy issues or people that have minor things they've just kind of written off, like erectile dysfunction that might be an issue a little bit, but they need some help. Like that's what we can also help treat.
yeah, that's wonderful. And then jumping back to kind of pregnancy and postpartum, kind of outside of what I had mentioned, what would be kind of the common things or maybe even some of the unusual things that you might be able to help women with as they're kind of going through this journey?
Yeah, postpartum, is a whole season of time that can come with a lot of challenges and a lot of wonderful things too. You're getting into the newborn stage. It's a whole whirlwind for your family to change, but your body's changing a lot as well. So all those hormonal changes and hormonal shifts in your body, estrogen, progesterone kind of tank and kind of drop. Those first few weeks are really integral in a lot of things changing. So your body can like have a lot of weakness going on. You may also notice some prolapse or heaviness symptoms happening. Those are kind of common leakage issues in the beginning. And then noticing like just fatigue and just kind of like some soreness and just kind of overall body stiffness. His birth is kind of a marathon event. It's this whole big event for your body. And then being able to come out of that, in 6 weeks, doctors always want to just clear you for everything. But really, there's a lot of things to still work on for the whole first year postpartum. And you really won't feel
Mm-hmm.
quite like yourself for quite a long time. Those hormonal shifts are still present as long as you're breastfeeding, and the tissue health of the vaginal area can be really important to keep a watch on and notice. I know that a lot of people oftentimes don't think about something called granulation tissue. Like granulation tissue is something to look for on your first visit postpartum with your OB/GYN or midwife to look for to make sure that they don't have that. If they have a vaginal tear, it's basically excess kind of scar tissue buildup or new tissue growth on top of the scar that they want to be able to treat and take care of so that it doesn't cause extra pain with sex. So those are some things to kind of look out for that are kind of uncommonly known. No one knows about that,
Yeah.
but it definitely is key.
Yeah. And that was one and again, I had been working with moms for like 7 years, and I
Mhm.
had actually never heard about the tissue. I had definitely heard painful sex. However, what you had said was sometimes the painful sex is it could be tightness, but
Mhm.
it could also be tissue health because with the hormones, the tissue is much more fragile. Is that kind of that's what you basically said, right?
The estrogen can be lacking, and so therefore the tissue can kind of get more fragile and dehydrated. And even if you have a cesarean section, that scar goes through 7 layers of tissue in your belly, and the tissue that's in the belly connects to the pelvic floor intimately. And so the scar tissue, if there is tightness at the cesarean scar, it can actually impact the vaginal like opening, that first layer of pelvic floor muscles and second layer of pelvic floor muscles that can create more sharpness or stinging or burning. So I have quite a few people that think that cesarean sections just spare the pelvic floor and they'll have no pain with sex, but really oftentimes they can have more pain with sex and burning and stinging pain that's different than they weren't expecting to have
Right.
that scar.
Right, right. And I think also for I had someone tell me, this is what they said. Okay. I had a C-section. Um, was not what I hoped for, but that was what it was. And I had someone say, well, why are you paying a pelvic floor therapist? Like you can massage your own scar. And it's kind of like, okay, it's so much more than this.
Yeah.
Like she doesn't just like, oh, do along the scar,
Yeah,
like it's really, really um, in-depth work and in-depth assessment. And I feel like you have talked about things that very few other people have really ever mentioned.
sorry, please excuse my cat. He's about to make an entrance. This is my
Oh, no worries.
cat.
Animals are always welcome. You
They
have two cats,
are.
right?
Yes, 2 cats,
Wow.
little Mr. Bubba, and this is big Mr. But anyways, yes, the C-sections are definitely a lot more involved for treatment. I feel like one thing that's also unknown is the urgency. Like your actual bladder urges can take a long time to return, and sometimes people don't realize that. Like you can go 6 hours and go, "Oh, I probably should go pee. I need to be going to pee," and it's been
Right.
times without any urgency at all. So we can kind of help do some specific
Right.
things to help those urges return to
And
normal.
that was something I had issues with
Mhm.
initially as well, and probably one of the things that was like my biggest concern coming in postpartum. And I'm going to say in my case, I went to the OB to get my 6-week checkup. Mostly I was like, "Ugh, I'm not expecting them to give me a whole lot of information, but I just want to know, is my incision healing well?"
Right.
That was kind of why I went. And it's just, I think it's shocking to me because they say, oh, okay, you can go back to life as usual, just anything you want to do, exercise as much, any kind of exercise, any kind of anything in life, don't
Mhm.
worry about it, just don't get pregnant yet.
Yeah.
That was like the only thing they said. And it's like, well, what about pelvic floor therapy? If you want. And it's kind of like, wow, how is this not, like, to me that seems like not exactly criminal, but almost criminal. Because it's like I was going in saying, I can't feel any urge to pee. I have zero urge to pee.
Mhm.
I literally could go 14 hours and I would have no idea.
Yeah, which is dangerous, and it can be urinary retention, your
And
can burst.
yeah, yeah. And she's like, it's fine, nothing to worry about, nothing to see here, nothing, whatever. And I'm going, wow, that's really like there's a lot of gap in it's one of the gaps in care I
Right.
think that exists is there's kind of um yeah, just a gap where either people don't know about it or they don't feel comfortable to refer in that way or even mention it.
Right.
And then women get left with either leaking and years later saying, "Oh, I still pee every time I laugh." And it's like, "Oh my goodness, your kid is like 7."
Yeah. I think there's a lot of people too that think that it's only for certain things or only for a certain population. Like I've had some people that have sent people to us that they have so many things going on. They wait till the absolute just tons of things are going on where they have all the things on our list: bowel, bladder, sexual complaints, pain, just like 10 out of 10 crazy stuff going on. And that is a great patient for us to treat. But we can also treat the people that just have one thing going on. Like waiting till don't let it get that bad.
Right.
They actually send them to us. Like it does not need to be like to the end of the road to go see a PT. It can definitely be early on or preventative. Like just if you're wanting to
Right.
wellness, like have a good birth experience and just go for wellness care. That's a huge thing that we can also do, and people don't understand that
Yeah.
standard of care overseas. Overseas, it's utilized automatically. Every woman goes for like 6 weeks postpartum, and
Oh
they
wow, that's great.
work in the hospital. They
Yeah.
assess the pelvic floor. Like, day one, they're there like after birth, helping guide the it's so different overseas than it is here in America, and it's really sad. A maternal health issue is that
Right.
we do not get even really told about it. It's like the secret under knowledge thing. It's getting more traction with social media, but it's definitely
Right.
an awareness issue.
Right. And it's really, I mean, to me, that's just crazy because I feel like people suffer for so long. So I'm going to tell another story about myself. I'm just going to share all the stuff. I guess that's where we're going today. But so I had pilonidal abscesses when
Mhm.
I had my first one when I was 19, and then I had two more when I was, I don't know, 22 maybe,
Mhm.
and ended up with multiple surgeries and procedures kind of in my tailbone area.
Mhm.
And even with that, no one ever mentioned pelvic floor therapy. But yet I had had issues, certain issues, like that existed from 22 up until 37
Yeah,
when I
no,
was seeing you postpartum. And it came up at that point, and it was like, oh, wow, like this has gotten better too. And that's been an issue for like over a decade. And because I didn't know.
yeah, and I feel like tailbone injuries, a lot of people have a fall on the tailbone as a kid, and that's a huge, like, puts you at risk factor for future pelvic floor issues because, the deep pelvic floor attaches, all the pelvic floor muscles attached to the tailbone. And so at some point, if there's a trauma there, or a palatal cyst, or like an issue, any kind of surgical procedure, or anything ever happening at the tailbone can really impact the pelvic floor for the future. And so having a PT to assess at the time of the injury or surgery is hugely helpful, but especially, within 2 to 3 years at least, to get some work done to make sure that it's optimized again. It would have been great for you to have. And I hate that you're older.
Yeah, no, and I'm grateful I have it now, but that's kind of, it's like, I just, anyways, it's just one of those things. I'm like, people just need to know more about this. So,
Right.
anyways, that's partly why we're here. So,
I'm glad to be able to spread awareness. I love telling everyone.
Right. But so what are some of the things that you hear from women, like issues that they're having, that almost never get talked about, that are kind of like the secret of pregnancy or postpartum,
Symptoms.
kind of like things that happen? Like, I know we had talked about the tissue, like kind of the changes to the tissue that people maybe don't know about, but what are there other ones?
I feel like there's a lot of assumptions and myths about postpartum and things that people have just accepted as normal. And people think that leakage is normal, and it's really not. It can definitely be treated. I feel like people don't realize the heaviness, that heaviness and pressure aspect. They now consider like having like a small little bit of the bladder descent postpartum is like somewhat normal. But if you feel a lot of heaviness and pressure, and you think something's falling down or falling out, that can also be treated, and not necessarily with surgery or like having to have a pessary or these other kind of radical interventions. PT can really treat those symptoms and help with that recovery a lot with those symptoms, and not have to deal with that. The libido is a huge thing. People like assume will just kind of come right back, and that's also commonly decreased for longer than everyone thinks. Having those natural return of your hormonal shifts, and with periods return, that's a big like kind of time frame where things start to kind of come back a little bit. But I think people always think that, it's just I should just want this, and they oftentimes don't for a very long time. So that's something I have to kind of help walk through and learn, like that they're not alone, and that a lot of women feel the same way. People think that people have asked me before, like, hey, I really I should be having sex right now. I should be doing this. I know I should be doing this. And I'm like, hold on, there's some expectations. There's no like magical number that's right for everybody. Most people do take a lot longer than you think, and you're not alone in that, with wanting that to come back.
Yeah. And I think that's another, I kind of get a little annoyed with social media when it's like, oh, we had the 6-week appointment. Yay! My husband's so happy. And it's kind of like, I think that it's an unrealistic expectation for most couples that by 6 weeks, you're going to be like jumping back into it.
Most people are like passing ships in the night. Like, I have tons of moms that are like, we just are maybe sleeping a little bit and can barely hanging on. Like, it's a big shock to the system just to have that in that newborn phase. And I feel like in 6 years, I've met a couple of people that were like rearing and ready to go, but most people are like several months, even a year. I mean, just a long time to really get their feet under themselves, get this mom and dad thing down, and then they can feel like they're able to really connect again. And the natural depression of the libido from, or suppression of it from the hormonal side for women is also a thing. So I think that's a lot of educating I have to do with women, and just common things.
Well, and so I'm super pro breastfeeding. I think it's amazing. I think the benefits for mom and baby are huge, huge. And I think what you had said too is that the prolactin, yes, kind of decreases the libido. Do I have that right?
Yes, the prolactin and the oxytocin, they're the ones that are higher in this season, and estrogen and progesterone are what's lower. So therefore, like, that's why the prolactin, the breastfeeding hormonal shifts is what's causing that suppression of the natural libido. So like that's a common, I guess, something I'm talking to my moms about a lot is that whole topic, because that goes for just feeling so guilty. They don't need
and I think it helps knowing that going into it, because it doesn't mean, oh, stop breastfeeding right away, so so that you can get back to this part of life. It doesn't necessarily mean that, but I think it does help going into it if you have an understanding of this is a long journey.
Yes.
Like, we're looking at more like it may be infrequent for a year, because I've heard that from women too. Like, like, I don't know, we did it maybe twice in the whole first year.
Yeah, no, that's not uncommon for me to hear all the time.
And
Necessarily say this, they just really didn't feel that desire. They didn't have the time. Time's a huge
and
thing.
time is big too. It's like, okay, the baby's sleeping, yay. And both people somehow are in the mood, which all three of those like in one segment, it's like, wow, that's like a unicorn of a day. But
Yeah, it's really, it's really common. And so the whole breastfeeding journey is important to so many. And that's, I think I try to set people up with that knowledge well when they're pregnant. Like, when they're pregnant, I'm telling them, like, hey, don't feel this a huge obligation. Just return to everything in life at 6 weeks. It's really going to look a little different than that. And like, I think helping the husbands understand that too, is all they ever heard is the 6 week rule as well. So if they're not communicating, and they don't know that that's also really common to not.
well, and I think it's good for both partners to know that libido can be also decreased, because otherwise it's not about like not being attracted to the person anymore.
Right.
And you had said that's also relatively normal for women to, with the hormonal changes, to just like to almost have libido be not just at zero, but maybe slightly in the negative.
Yeah, like literally just be, and there's a lot of emotional things tied in. I mean, you're talking about being up all night half the time with the baby. Sometimes the husband's getting to sleep, and you're having to stay home, and maybe you want to go back to work and you couldn't. Like, there's a lot of emotional things tied in, with this the newborn season. So there's a lot of things that can come up, and so I think helping that communication with partners is just openly telling them about, getting some therapy if they want to, helping with medication support if they need to, but helping their mental health kind of stay high is huge, and communications matters a lot. I just try to support women where they are, meet them where they are, because they usually have all these things they're kind of talking to me about in sessions. And I'm like, just know you're not alone. There's so many women just like yourself.
Yeah, that's really good to know. And then as far as periods returning, because there's also, I feel like, a lot of it's not really like a secret, but um there's a certain amount that's like unknown in that time. And even of, well, I don't have a period, does that mean I can't get pregnant again? And it's really like, even if you Google it, it tells you nothing. And I was like, how as women do we not know? How do we not know this? Because this is such, like,
And
this is important to understand about our own bodies.
so variable too. Like, I have people who can be breastfeeding and they start their period back at like 3 months, and then they're breastfeeding the entire time, or they're breastfeeding the entire time and they get their period back at 18 months, and it's been like a year and a half later they still don't have. Very variable. There's not really one size fits all when it comes to the period. And then I often hear people tell me, like, when their periods return, they're kind of more crazier than they used to be before, like heavier and stranger. Maybe there's more pain than before, or there's no pain, there was pain prior. Like, so it's just so interesting how it changes a lot. But as far as the pregnancy goes, or pregnancy risk goes, there's definitely still, you can still get pregnant while breastfeeding, while not having a period. The ovulation is just different. Or you may be able to, like, before you have your period, you can be ovulating and not know it. So it's kind of this like low level risk the entire time. So it's definitely better to use protection as far as condoms go in that season when you don't know, you're not able to track your cycles. Or there's also ways, there's ovulation strips. There's now, I think, some like the temp drop and temperature tracking that you can kind of do throughout, and you're kind of seeing if there's shifts, but there's not a really perfect solutions besides condoms right now, unless you are on the birth control methods.
Right. Which all come with their own risks as well.
Yes.
So it's good, I think that's also something women should know and go into that informed. It does, oral contraceptives they do come with, and even IUDs, they do come with a certain amount of different risks.
Right.
Tell me about this Kegel obsession. that, okay, so I think, my goodness, I'm like, when did I first hear about Kegels? I think I might have been in high school.
Mm-hmm.
And people are like, you don't want to get all loose down there because,
Mm-hmm. People think tighter is
and they're like, better do your Kegels every day and like keep up with that. And, or, oh, you had a baby, you're going to be all stretched out. Like, if you still want anyone to have pleasure with you, you got to do your Kegels, because otherwise,
Yeah.
Tell me about this, because I don't think they're always appropriate. And I think that the tissue is probably much more, I don't know what the word, like, its ability to bounce back and heal, and its ability to stretch and then come back is is probably greater than people realize.
We call it the length tension relationship of the pelvic floor. So you want to have length and a natural level of some, like that length tension relationship needs to be established in the pelvic floor for it to kind of work. Our pelvic floor is reactive all day in different types of movements. So when we move to the side or jump or sneeze or cough, it needs to be able to like contract, relax, and kind of hold tension there at a healthy level so they don't leak, so that things don't come out. But also it needs to be able to relax and expand to allow for things to come in, like during sex or a tampon insertion, that kind of thing. It doesn't need to be too tight all the time. Kegels, unfortunately, sometimes they're very misunderstood. A lot of people think they just need to be doing zillions every day, and they need to do them as much as they can and as fast as they can and big amplitude, and that will make them have the best pelvic floor. And that's really wrong in so many ways. There's no magic number to be doing every day, and most people actually do them incorrectly when they first learn. A lot of times people will maybe squeeze their butt instead, or they'll like try to move their inner thighs or something else weird and not actually use those innermost muscles. So a Kegel itself, what it is those inside muscles getting like a little squeeze and lift. And like so that those both the squeeze and the lift are important for a full Kegel contraction. And we are able to like assess if you're able to do that with an internal vaginal exam and to kind of really hone in, make sure you're able to do one correctly. And that you also need to be able to like lengthen the pelvic floor beyond its range of motion. So you kind of have the contract, you have the relax, and then like a lengthening, like you would whenever you are having bowel movement or like passing gas or being able to like when you have your baby, like that lengthening motion and then returning back to normal. So there's a full range of motion of the pelvic floor that happens, and all those motions are needed during the day with different types of activities. So folks that do Kegels all the time sometimes tend to have things be like, maybe they were already resting kind of tight and they do all the Kegels and it makes them more tight. So you won't really know if you have like resting tightness or if you're really, really weak. You may have symptoms of leakage or like having issues with pain. You may not necessarily know if it's weak or tight until you get an exam done by a professional, a pelvic physical therapist. But I will say that like oftentimes there's no way to know, if you have leakage, does it not mean automatically that you're weak? And you could also be a little bit tight, and the tightness, you have nowhere else to Kegel, nowhere else to go. So the leakage just comes out because you're too tight. So you really don't, it can be either way. So I wouldn't just blindly do Kegels. I never recommend that. We only give them out, with people that have in the absence of all pain and the absence of no tension. They really truly need to be able to do some more strengthening there. We might give a little bit of those, but we never do them in isolation. We're also doing strengthening of the core, the hips, the back, other accessory muscles around the pelvis to help stabilize the whole thing. But you can kind of guess, you may have some tension if you have pain with sex already, or if you have low back pain and hip pain, and how inside butt bone pain or tailbone pain. You may have some tension issues, and I would definitely not do Kegels if you have any of those going on.
Okay. So regarding kind of like the vagina and the cervix, because I think a lot of women also get this fear when it comes to vaginal delivery. And I have heard some of my former patients who have said like they went to see their OB later after the fact and they're like, wow, that baby really did a number on you. You're going to need plastic surgery to fix this. And she felt really like, oh my goodness, like giving birth vaginally just destroys the whole area. Can we talk a little bit about the ability of that tissue, like what makes that tissue special that allows it, one, to expand enough? Oh, I'm echoing now. But, oh, that's why. To expand enough to have a baby come out, but then how it can also come back to at least close to where and how it was before.
The great news is that's totally a myth that, having multiple partners or having, a baby can just make it too loose forever. It definitely can recoil. The tissue is meant to be elastic, and it does have that recoil ability. And our vaginas can actually expand, I think, up to 8 times its size and length for having baby and accommodating like things entering. So I think that is definitely a misconception hugely. We can have that recoil. Estrogen in the tissues makes a huge difference with that. So that's also why maybe initially postpartum there could be a little bit more of that kind of more fragility or not as plump of the tissues as there was, prior to baby being there. But then it does return as your estrogen levels return to normal. And even some topical vaginal estrogen you can get from your OB/GYN can also really help in the postpartum season to kind of help boost the tissues back up and help with that recoil. That's a really common thing to help.
Okay, awesome. Yeah, and then we had touched a little bit on C-sections already, but like in regards to that, because most of the women I know who have had C-sections have never done any recovery,
Mm.
and which I think is crazy. But tell me a little bit more like what makes, I mean, I think pelvic floor therapy is actually really critical for everyone's postpartum healing journey.
Mhm.
But in regards to like a major abdominal surgery, what makes it even more essential, I guess would be the way to say it.
I guess we can start thinking about the core, as a core canister. So you have the front of the belly, and you also have your low back, and then you have like the sides, the obliques, your diaphragm, and then pelvic floor is the bottom of the core. So we're able to kind of assess that whole canister and see, what's going on. Whenever you have a C-section, they cut through all that front portion of that core canister. So they go through 7 layers of those tissues, and it does connect the intimate ones at the bottom do connect to the pelvic floor on the bottom too. So there's a lot of connections that I mentioned and alluded to earlier, the stinging and sharp pain, some of those nerve style pain as the nerves are waking back up with the scar can impact the pelvic floor too. So what we do as PTs, we not only assess your scar, we assess your ability to move your spine in different directions, be able to have your hips and back be able to move with the way that this new tissue is. And if there's separation in your abdominals, we're able to kind of help those gain more functional strength. There's not always that full closure for everyone, but like if we can get them to within 1 or 2 finger widths and be able to help that the shallowness be there of this core getting really strong to support your back, that's huge. And you don't realize how much you're using your body. I mean, people always think, oh, I don't lift that much weights, but you're lifting your babies quickly grow to like 40 pounds.
Yeah.
And they think they can grow
Yeah.
here, like they're like so big.
Yeah.
Being able to have strength in your whole body, we do a lot of that. We also are able to look at the nerve function and nerve sensation return. We help with a lot of that to the scar, that whole area. I have ladies that come in their 50s that have never touched their scar and never want to have their pants touch their scar. And they don't look at it, they've not seen it, and they don't look down.
Yeah. Well,
They
that's a really important thing to bring up too, because I do feel like, see, and it may be a little bit for all women postpartum of like your body is just a little bit different.
Mhm,
But I think when you have a massive scar across your whole abdomen,
mhm,
um, I think it can mess with your feeling of how you look. And
mhm,
typically you get that little bump
mhm.
as well. And I know people have told me even years later, like, I'm just not really happy with my body because I have this weird little bump since my C-section. And so that's actually really what you're touching on there too, like so important to keep in mind. And wow, like even that many years later to still not want to look at it or to feel like it's ugly or
Yeah, and it's so hard to see that because 'cause they've never been told that it could change. They've never been told they can touch it without cringing or touch it without it hurting, 'cause they just thought that's how it had to be. So then we're able to start changing that by helping those nerves wake up a little bit, and then helping them feel confident in it. Like, I always mention, positive self-talk, being able to touch it and feel, a lot of love. This is where your baby came from, kind of, good things to say. But I do feel like it takes a long time to really feel confident in those areas. But the little shelf that a lot of people want me to work, everyone comes into me and wants, help fix the shelf. It's a really common reason people come for therapy. And it can get stronger and more supported as pelvic floor gets stronger, as your core gets stronger, it can start to reduce over time. Sometimes it's adipose tissue, but sometimes it's more like the scar, like the tightness of the scar itself, pulling the tissue in and causing shelf to kind of form. But when the scar loosens up and the tension deep down inside kind of releases, it can definitely be more of a flatter surface, which helps a lot of people with that image and confidence.
yeah. Yeah, out of curiosity, how long is the typical C-section scar? Because again, this is a big misconception because I've heard so many people say, like, oh, it's a C-section, like that's not surgery.
I will say it
And
seems to vary for most people, but I mean, I feel like it's a good 6, 7 inches, whatever this is. I feel like it's definitely this big. But I've seen folks have kind of more of that wider one. If there's if sometimes there's complications, if there's issues.
Mhm.
And if they go through multiple, I've had people have multiple ones done, then kind of they try to go through the same one every time with this different surgeons or different OB/GYNs, but sometimes they'll be above or below. Then they have this weird, like, kind of 2 or 3 scar scenario
Multiple.
underneath that area. But it's not really not super small, but it's not crazy big as an abdominoplasty scar would be either. But it's definitely like it's still significant. It's a major abdominal surgery that requires postoperative
Yeah.
care.
Yeah. Yeah, and that's good to know because I do feel like C-sections get the potential risks of them kind of get downplayed a
Mhm.
little bit. And it's like, no, it still is a surgery. It's still a big surgery and it still takes time and effort to heal from it just like any other major surgery would.
And it's even harder if you have a
Yeah.
toddler at home and it's your number 2 or number 3 and you're just it's a busy mom, it's really hard to rest that first week. Um,
Yeah.
that's critical.
Yeah. Yeah. And it's so I think also just my perspective is going into birth, it's like plan for your postpartum because you don't know exactly how it's all going to look, but kind of like have some support at the ready, like have some food in the freezer and maybe have someone who can like come and stay with you for a couple of days if you need, or have your partner take time off of work or things like that. Like plan ahead and then hopefully everything goes perfectly and like really amazing and you just get this beautiful amazing time to all bond and
Yeah,
spend time together and still rest because regardless birth is a lot.
yeah,
And if things go poorly, then it just requires even more healing and space and gentleness to recover your body and mind.
right.
And so, but yeah, C-sections are interesting and I'm trying to think if like I think for me, because I know you had given me exercises like once it was kind of like all the way sealed and all of the tabs that they had put on it all came off. Initially, I could not look at it at all. I could barely touch it. Like it made me feel like I was gonna faint in the shower trying to like wash it a little bit or like pat it dry. It was like so hard. And then even when I started to do exercises with it, like just like gentle, the massage that you had given me along the scar to start to mobilize the top of it, I got so nauseous.
Yeah.
It was like insanely nauseous
A lot of
just touching it.
they feel awful, and I people that are just they get so cringed out. It hurts so bad. Oh, it's definitely hard, and then all the emotions tied into it too, especially if it's not the birth that you wanted. And then if it's it's just there's a lot that goes into like having to touch it and then connect with it as well.
Yeah, so it is interesting, and I love that you acknowledge that how like the birth that you want matters too, because a lot of people will say all that matters is that you and baby are here and alive, and it's kind of like that's the most important thing. However, it's far from all that matters.
Right. Mhm.
And so it's always nice to have, and I feel like you do that really well. Um, because I feel like a lot of healthcare providers are not compassionate and they blame the mother and be like, you had a C-section, well, you better figure out what you did wrong.
Yeah, thank you for saying that. I think it's important to
And
have compassion because it's such a vulnerable time in your life. I've not had kids myself yet. I'm hoping to, and I think that I would definitely feel like people that have compassion are who you want to surround yourself with. It's a very vulnerable time.
yeah, it really is. And I think that is, for healthcare providers as well, that as women, we need to begin to expect that of our healthcare providers.
Yes.
And it's like if they're blaming you, if they're triggering you, if they're making the situation worse, maybe you need someone new.
Yeah, big fan of being able to find the support system that works for you, and you can definitely have the say of who you want in your hospital room. You can have the say of who you want to work with. You can have this freedom to leave and go see a different person, which is great.
Yeah. And I think that's easy to forget.
Mhm.
And there's anyways, it can be complicated to have the courage and wherewithal to make those kinds of decisions. But I think especially postpartum, I mean through pregnancy and stuff like that too. During delivery, it can get very chaotic in a hospital. It can get very chaotic. But definitely it's like postpartum. It's like just work with who you want to work with.
For sure.
And if they're not nice, leave.
Yes, and I think that's a big. A lot of people don't want to do like doctor shopping, but I think it's helpful to find someone you want and see someone different next year. If you don't want like the person you saw this year, you don't have to see the same one over and over. Even if because it's who your mom saw or who your friends saw, and you have to see them. Like you should definitely see someone new. There's
Right.
tons out
Right.
there, and especially in
Yeah.
our area, we have a lot of great people that are here in our area. Just finding the right one that meets your goals is important.
Yeah. No, that's absolutely. And so for the women who are, it's maybe been years since they gave birth and they have, whether it be urinary incontinence or issues of prolapse or whatever, and they just believe that there is no hope for them, that that's just the way it is, that that's just what happens when you have a baby. Ah, c'est la vie, shrug their shoulders and, don't believe that there is help.
Mhm.
What would you say for them?
They are some of my favorite ones to work with, and I love being able to help them see that there's so much they can do even and how fast it is. I think that's the coolest part about this work that I do, is that I used to treat ankle pain, it was always to treat orthopedic therapy and pelvic PT at the same time, and when I would treat someone's ankle or shoulder, it takes several weeks to really make a difference, and there's pain, and there's get stronger, but with urinary incontinence, it can be really fast, and then urinary urgency, it can also be really fast. 2 weeks, and they can make a huge change in their symptoms, how much they're leaking, how much they feel. A couple of tips and tricks, a couple of things to try at home. Looking at their like we do bladder diaries, helping them see what's on paper, like how often they're peeing, what they're like eating and drinking, and how it correlates with what they're emptying, and all these different things. It is so cool to see how fast it works. So I think that helps them buy in. They're like, oh wow, like it works so fast. Why have I waited 25 years to do this? They're so excited. And then we roll with that excitement and motivation, and then they're able to, within 1 or 2 months, boom, all the years of symptoms are just gone, and it's really cool
Yeah.
to see that.
Yeah.
I just try to help them stay motivated in the beginning. I think this is the fact they all come in jaded. They're like, well, my daughter told me to come do this. I don't know if this is going to work. I've not had this ever. And like, this is a new thing she's doing, but I don't really need to be here. And I'm like, well, I'm glad you're here. You have lots you can work on. Let's give it a try. And then they're so excited because it works for them too. You're never too old to get help.
Yeah. No, that's amazing. I had one other thought is about fertility.
Yeah.
Like pelvic floor therapy and pelvic health and fertility. What is the relationship between those?
So it's interesting. I guess there's not any like research or actual data that show that we can actually truly change, fertility. But however, there's a lot of things we can do to enhance, I feel like, someone's fertility, and that we are able to help them be able to have sex if they can't have sex. People that are obviously, you have to be able to have sex to be able to have a baby, and so folks that are limited in their ability to have sex, we can help with that. We help them be able to accommodate and work with their partner, and like over all that goes into that. Also helping them learn about their cycle, like helping them make sure that their menstrual cycle is regular and into the ability that we can help with that. We're able to kind of help if there's any restrictions of the uterus or ovaries. We can kind of help free up some blood flow there and help give them some holistic kind of tips and tricks to help with their cycle. And then teaching them how to track their cycle and learn when to have sex to be able to get pregnant, that kind of thing. We're able to do a lot of that education as pelvic PTs. We're able to give lots of like kind of generalized advice on like that kind of pregnancy kind of planning and helping them guide folks to the right other practitioners. We do a lot of collaborative work with like some local women's health dietitians, like functional, like one-on-one people that do a lot of functional medicine type testing to really kind of get to the root cause of why they're maybe struggling with fertility. A lot of work with acupuncturists and Chinese medicine in town. We do a lot with those folks as well, with referrals and some of the actual fertility doctors in town, like true like IVF planning. We can help it enhance like IVF, have a kind of getting them ready for the transfer and all that kind of stuff. So we do a lot of visceral work on the uterus and ovaries and like helping to enhance any restrictions or tension that could be around those organs and the fallopian tubes at sometimes of areas, and then help make sure the pelvic floor is as healthy and strong and relaxed as it can be.
That's awesome. I love that. So tell me, what would a normal visit kind of look like? Or what would an initial visit look like?
Yeah, so the first day is the most fun. I feel like it's where we can really kind of dive into what's going on with all the symptoms you come in with. So if you have nothing going on, you're just kind of wanting a pelvic floor, just check in to say, hey, I've heard about this pelvic floor thing. I want to see what it's all about. We'll basically just go through a full body exam and kind of see what's going on in like your abdomen, your low back, your hips. We kind of do a full external exam. And then we also go through a lot of medical history. We also ask questions about your bowels, bladder, sexual function, pain, kind of diving into OB/GYN history, your cycle, menstrual cycle history, any sort of conditions you could be having. And then we do the full body exam, and then we also do the internal vaginal exam as well, or rectal exam, depending on what you have going on. Oftentimes, we'll start with vaginal exam for a woman first, kind of see, we're able to test for prolapse, you're able to see your strength of your pelvic floor, like your Kegel strength, if you're able to lengthen that secondary portion of the lengthening and contracting, that whole range of motion, we check for that. And then we get a game plan towards the end of what we're going to be able to do to help you if you need help with symptoms. If you don't have to help with symptoms, we kind of talk about like a maintenance plan, like what would be healthy for you to be able to do to keep your pelvic floor functioning. We go through a lot of like tips and tricks on how to have optimal bladder function and bowel function, that kind of thing, if you have no symptoms. But if you have symptoms like actual constipation or actual pain or actual leakage, we'll kind of get a game plan for what that looks like in therapy. And it's not often as long as you think that you'll need to be there if it's something simple. If there's a chronic, complex case of a long time of things going on, it could take several months for sure to make a difference. But we should get a game plan established on that very first day. We can learn a lot about you in just an hour of time, which is great.
And then for women, I mean, I think most women probably who are pregnant and going to be having a baby or just had a baby, there's a certain, I don't know, loss of modesty or caring that maybe happens. So probably most women are not necessarily going to be uncomfortable with an internal exam, but should there be a woman who was, or let's say a mom is listening whose daughter maybe has painful periods or something like that, who might consider pelvic floor therapists, pelvic floor therapy. What would you kind of say to them? Because it's an option as far as
Right.
whether you can still help someone even if they don't want the internal exam.
Right. So not, I would say it's definitely not required to be able to have this internal examination. It is helpful for us to get the full picture, but definitely not required by any means. So we are able to kind of see a lot from the outside. If you're open to an external exam, we can definitely see a lot from the outside. We are able to kind of see if there's tension you're holding in like your glutes or in like all those muscles that are a lot along the pubic bone, in the inner thighs. There's a lot we can kind of understand if there's tension in those areas. We definitely can guess there's probably internal tension as well, and go ahead and be giving you stretches and some things like external manually wise, like using a little ball to roll around on, or like getting like a massage done externally. We also can do massage ourselves externally and then show you how to do it at home. And like on your belly, that's mentioned, the belly is a huge thing. If you go see a pelvic PT and they don't even look at your belly, you probably have not gone to a good physical therapist. So I think belly is a huge place to look as well. So we do a lot of external stuff anyways. The internal portion is a piece of the puzzle, and it's important to find a pelvic floor therapist that is internally trained at least. Even if you don't want to do the internal exam, it's helpful to go to someone that does know that information. And then later on, as we kind of get more comfortable with each other, and if you wanted to do that later on to kind of fit that last piece in the puzzle for us to see all the things, we can definitely do it like after that initial visit, after meeting. But it's helpful the first day, but not required by any means. For someone that's younger, we definitely are able to do it. If they're able to wear tampons, we're able to do the internal examination basically, but we always have to request they're able to be cleared by OB/GYN if they're not been sexually active in their life. But if they've been sexually active, then we're able to do the exam. But it does get tricky with minors, and they have to have consent from the parents, of course. And for painful periods, there could be a lot in the belly to work on. So we do a lot around their uterus and a lot around those ovaries, and like their low back and hips, and just having given them some basic, like, once again, tracking cycle things, even a lot of like basic nutritional things. Like a lot of women are under fueling and not eating enough. So just going over a lot of that kind of thing to make their periods better can go a long way without having to ever look inside.
Yeah, no, that's great. I think it's good to know. And then you had touched on it a little bit, but tell us how does one find a really good pelvic floor therapist? Because because it's so, because you have your degree, right? So your doctor of physiotherapy. However, that doesn't guarantee that you have the pelvic floor therapy training.
Right. So it's really hard right now in the United States, there is no standard of care with this, and there's no standard of education with this, which is really hard. And I hope one day this changes. But basically, anyone that graduates from physical therapy school, doctor of physical therapy school, we go for, we had for undergrad for 4 years and then 3 years of doctorate of PT school, you can claim to be a pelvic floor therapist and have no training. There's no one going to stop you. You can definitely say that you are one and then do whatever you want to do, which is really hard because like in the general public is like, oh, I'm going to go see pelvic PT, and then if they have a bad experience or they're doing zillions of Kegels or something that's bad for their body and they get worse, they're like, well, this didn't work for me. I'm never going to go back. So it's hard because there's no way to technically know. So I'm going to use some top tips of ways to kind of find one. So basically, you want to really vet the place you're going to. If you're going to a big insurance gym, and obviously insurance practices and out-of-network cash-based practices are pretty different. If you can only go to an insurance-based practice, that's okay. But finding someone in the insurance practice that is internally, vaginally, and or rectally trained. So being able to do, like finding someone that, and I would call and ask before you just get a referral to pelvic PT and you go somewhere, I would say, hey, is this therapist internally trained? And if they are, that great. That means they at least have level 1 training and being able to learn what the vaginal exam is, learn about the muscle, like learn basics. If they don't even know how to do that, it means they are just kind of marketing the R1 and probably they don't even know what they're doing. So that's an important factor. And then other people said that they're pregnancy and postpartum certified that also have no internal training. And you can do an internal exam when you're pregnant, especially after that first trimester. We mostly can do that and kind of see. So I think it's important to know what's going on there to prep for birth and labor. So definitely want to find someone internally trained. Number 2, finding someone that is board certified, like having an extra certification really means probably have put in the work or at least several years of a lot of training. So the way we learn this work, in PT school, we have like one lecture on the last year of school about pelvic health. We learn like a little bit of the muscle anatomy, maybe some pregnancy contraindications, and that's it. So then post-doctorate degree, we are able to do all this extra training on like long weekend courses or multi-day courses to learn like all kinds of different conditions. Like we learn about how to do level 1 is like vaginal exam, learn how to do that. Level 2 is like learning about male pelvic health a little bit and like some bowel conditions, like kind of learnings for all kinds of different things in different organizations in the nation. But basically, it's not it takes a long time to get a lot of those trainings done. So it took me 4 years to get my board certification. So finding someone that's been in practice for several years, that's also a good sign. So checking that box. So finding someone that's been there for quite a while doing just pelvic health is helpful. And then finding someone that does specialize in maybe whatever you're having. If you have a condition, like if you have endometriosis or if you have IC or pediatric neuralgia.
What is IC?
Interstitial cystitis. It's like a painful bladder syndrome or bladder condition. Finding someone that does specialize in that might even be better than just a random pelvic PT. So you could call and ask to speak with the PT and say, hey, do you treat this? I would love to know. And they're like, what is that? maybe not a good move. If you go on their bio, so at our website, the Pelvic Method, we have like a whole list of our bios of what we each like love to treat. Like I love to treat chronic pelvic pain and IC. That's what I specialize in, is doing a lot of bladder syndromes and like painful conditions. That's what my favorite things are to treat. So sometimes people that are in these more independent practices may like list out what they love to treat, and you can kind of select your therapist who you'd love to be with for those kinds of things. That's great. But if you're kind of just getting a referral to someone random, you definitely can call and vet the place first. If you need help finding someone, feel free to reach out to me, and I can give you like a list of places in different cities. There's definitely a directory online you can look up where my board certification is, like the directory of people that have the same certification or in different cities. So there's directories online for good people too. And if you're in a place where you're not getting the greatest care, if say you're going right now, you listen to this episode and you're like, wow, like I've only had one internal exam, I've been going for 10 weeks and they've done nothing, I'm getting worse. Like that's maybe a sign to find someone else. You can call or Google around, and there's probably several in your area to also look into. And I will say, you might think it's cheaper with insurance practices, but sometimes it's oftentimes not with the bills that you might get at the end and like the units and the way that they're charging for visits. You never know. It may actually be cheaper for you to go with the cash-based practice. It can be more all-inclusive.
People who are a little bit more rural, do they still have a chance of finding someone in their area?
I will say now it's getting way more popular. I started 6 years ago. I was like the only person in all of North Georgia, and now there's like 20 in Chattanooga, and like
Okay. Oh wow, there's a lot. I knew there was quite a few. I didn't realize there was that many.
There's a lot of us in the area, and like the couple in North Georgia. There's a lot more in the rural areas too. You may have to drive a little bit, but if you're going once a week, or that might not be as bad to do a 45-minute to an hour drive once a week if you had to. But definitely more than you think are available. There's probably at least one in every major area for sure.
Okay. Yeah, awesome. Yeah, and I mean, if you come from a city like Atlanta, I'm like, you're driving 35 minutes to get anywhere anyways, so,
Yeah, so it's definitely
so you're like, this is really worth the drive. At least it's not like for just groceries.
right.
You're like,
Yeah.
this is a drive with a purpose. It's worthwhile.
And I will say it's important to find someone you click with too. Like if you have that chronic pelvic pain or a history of trauma, like sexual trauma, those kinds of things. Not everyone has the best, I guess, personality to treat those things that would mesh with you and your needs. So if you go to somewhere and you don't feel comfortable or feel safe with this person that's about to be doing all these intimate things, it can be really, overwhelming to stay doing this every single week. So definitely make sure you find the right fit with your person. Make sure you feel comfortable and confident with the treatment plan that you have. Know what's going on, and ask them questions. Like feel confident in that you're seeing some progress and change. You should see a change with any symptom and any kind of anything in pelvic health within the first month. If you've gone 4 times and see no change at all, it may not be the best fit for that therapy.
That's really good to know. That's awesome. Oh, yay, this has been so good. Is there anything else you want to share? Any other like
I was trying to think of some things earlier.
spicy details that we haven't touched on yet?
I feel like just knowing that I'm glad that this is bringing awareness to this field. I've loved doing it. I think telling everyone about it is huge, especially for the men out there that need help. That's a huge to know for them to know about it. And for women to know they don't have to wait. Everyone thinks, oh, I need to wait till I'm done having babies, or I need to wait till I'm done, being pregnant, or they just have to wait. There's no reason to wait. You can go get an evaluation today and see what's going on. You don't have to wait, and it may be worth your time, worth your money. It may seem like a lot up front of just like a time investment kind of thing, but really, as you'll see changes quickly, and then be like, wow, I'm so glad I did this. I wish I'd done this years ago. Definitely not worth waiting. But I think
Except for you, because I know you have a waiting list.
I did. Now that I'm at the Ottawa location.
Oh, you have more space now? Oh, okay. Well, that's exciting, because I was like, I don't know. I'm like, I'd say you're worth waiting a few weeks for to get in.
Now instead of I used to book out 3 months, 4 months at a time. Now I'm like up into the next month or two. So I've got some openings, but not as many as before. Or not as full crazy as before. We just opened in August, which has been exciting out there.
That's great. I love that, and I love that you are just taking on like a bigger role, kind of running your own and you still work, with Dr. Aaron. However, you're kind of running your own space, and
it's been great.
Which is super exciting.
Yeah, it's going to be kind of like a new little holistic wellness center that we have over in Ottawa now, with like a doula agency, a midwife group, and a massage therapist, and then Inspire Chiropractic on our bottom floor. So it's another kind of big holistic wellness space, kind of like the one downtown on Macaulay Avenue, but now we're kind of doing similar vibe out in Ottawa. And it's been really fun so far getting to see just like that whole community. I'm able to get people from Cleveland and kind of bring people in from Appleton and those areas that were kind of missed earlier, because they were kind of more, they did not want to have to go all the way downtown.
It's just a little too far. Yeah.
It's been great.
No, that's amazing. I love that. And that just goes to show what a difference you're making for people, that the business has been expanding so much and really, really changing lives, and educating people and empowering women. And I think that's just huge.
Yeah, yesterday we just had a big event downtown with a lot of people in town for like a Family Wellness event. It was really fun.
Yeah. Oh, I saw pictures of that. That's amazing.
Yeah, so we love to educate the community. I think it's one of our favorite things about what I do now is getting to not only treat patients and help like people one-on-one, but really kind of be able to bring that awareness to the community. There's so many people that still don't know this work exists. And so I would love by the end of my career, when I get older, for everyone to be like, oh yeah, pelvic floor PT, of course I did that. I did that years ago. It's great.
Right? There was a time where people didn't do that right after having a baby.
That's fun to me. So we'll see if that ends up happening in fruition one day.
Let's hope when our daughters are of the age we are-ish now, maybe that will be the case.
That'd be a dream. It'd be amazing. That's real. Great.
That's awesome. Thank you so, so, so much for being here and for sharing. I'm just super grateful. And if you want to, for all of our listeners or viewers, if you want to connect with Dr. Brianna, I'm going to include all of her information in the show notes. And so you can definitely follow her on the social places and get the information for where she works. If you are in the Chattanooga slash Ooltewah, I don't know why I can't say that.
I just leave out the L. Ooltewah.
Ooltewah. If you're in that area, then definitely you can look her up. Or if you're just curious, I'll maybe include the link as well for people who are looking for a board certified practitioner. Maybe we'll include that in the show notes as well, just to give some resources for anyone looking for some help in any of these areas. So yeah, definitely. Yeah. So yay, thank you, thank you, thank you. This was really fun.
I know, this is really great.
Thank you for being willing to talk about things no one talks about usually.
Thank you for being here today. If you are loving this podcast, please go ahead and subscribe, and we would love if you would leave us a review. Sending so much love for you into this week, and we will see you soon.